Hi, everyone. It's Melissa, owner of Jacksonville Business Connections, with another live local interview from Jacksonville, Florida. Just wanted to let you know that our main mission is to connect business to community, and we do a lot of local community events and other various marketing strategies to help local businesses get their name out there. And today I have with me Dr. Marilyn James, and she's the owner of Haven Family Health, and this is located in the Jacksonville Beach area in Florida. Thank you so much for joining me today.
Thank you for having me, Melissa. It's a pleasure.
You're welcome. I um, really kind of relate and connect to the holistic aspect of medicine. And so when I kind of figured out that I get to interview you, I'm like, this is exciting because I like going that route more than anything else. And I love to hear about the different options that we have available to us other than mainstream. So for me, this is kind of personal and exciting.
Definitely. I'm excited too.
Yeah, so we can just jump right in if you want to share more about your business, who you are, and kind of how you got started.
Of course. So my name is Dr. James, and I am the founder of Haven Family Health. And this practice was founded on the principles of just doing true good medicine from your heart. I just feel like these days, medicine is just so corporate driven and just really insurance driven. And there are many physicians out there who want to spend more time with their patients, who just want to practice from their heart. And that is what my kind of practice allows for. It is a direct primary care model. Um, I have been practicing for over 2 years, and I thought that I would have my own practice maybe like 5 years after being in the real world. But this idea is just so good and so true that I couldn't keep waiting. So, with the support of my family and so many friends of mine, it just happened earlier than I expected. And it is just the right crowd for it too. It really was my patients who inspired me to make this happen because as I was trying to practice, I found that just using the conventional ways wasn't always working, and that it's very important to be able to practice in a more wholesome, holistic manner. And more patients were getting attracted to that, which has been a great inspiration for me to bring in other modalities and try to incorporate things out of just the conventional style.
Right.
So I noticed that with COVID, there is also a lot of telemedicine going on. And I have been doing telemedicine for almost 2 years now and realized we can manage a lot of things using telemedicine and increase accessibility for people rather than having them wait for like 1 to 2 weeks to get in with the doctor.
Right.
So all of those ideas came together to create my practice where I don't want to be confined by anything. I just want to be able to be there for my patients and deliver really good care in a very thorough, holistic manner. Yeah.
I love that. I really can connect to your message, and I'm so glad that we're getting and spreading the word to the local community. And I also forgot to mention, I was going to mention it when I first introduced you, that you will be at our Holistic Living and Healing Expo, and that will be, gosh, it's right around the corner, February 19th from 10 to 2 at the Renaissance Resort in the World Golf Village, and it is free to the public. And so if you want to come out and meet Dr. James, she will be there, and I'm very excited to have you at that also.
Yeah, yeah. Thank you. I'm
You're
really
welcome.
excited about that. That's what I was saying, that the Northeast Florida crowd, it just is a very inspiring group of people here. And I am very just motivated by them to keep learning further about all of this and see how the crowd wants to be healed, how they want to be approached. So, yeah, the expo is a great opportunity, and I'm so glad I found out about that. It was one of my friends who is a realtor who told me about it. So I'm
Oh,
really
nice.
excited to be there and meet more people.
Yeah, definitely. And so how do you, since when you started your business, where do you think you are mostly getting like your clientele?
So, oftentimes patients just Google my name to see where I went, and then they try to find me again. Other other times it's just by word of mouth. And that's very important for me. I really just want this message to spread by word of mouth and by people hearing my voice and hearing what I'm about, because that's just organic growth. And that's how I practice and how I just do things.
Right.
So I'm hoping to just have a small group of patients. I'm not going to have thousands of patients. That's not what I want. I want to just have a few hundred patients and just let the growth be organic, meet people personally, and let them witness how they feel the care is. And if they feel like it is what they want, they will spread the word and let others know. So I'm just going to let it happen like
Oh, I
that.
love that.
That's why I love interviews and just being able to have others have venues where they can hear my voice and meet me. And that's why I'm so grateful that you're giving me this opportunity.
Oh, you're welcome. Absolutely. Why don't you tell us about maybe a couple of your most popular services or what people seek you out for, um,
hmm
just so people can get an idea of if they're experiencing that or they've been looking for solutions and haven't found it. Maybe they can connect in that
Of
way.
course. So I'm a family medicine physician. I take care of kids starting ages 4 all the way through, I have patients who are 100 and plus years old. And my main thing is just being able to spend quality time with people to get to the root cause of any problem. And it could be as simple as people having diabetes. We're not just going to be talking about, oh, these are your numbers, this is the medication you should be taking. We're also going to look at the whole picture. Is there stress going on? Are you on any other medications that may have caused this? What is your lifestyle and eating habits like? What is your family history? How is your mental health? Because our human body is a conglomeration of so many things, and there are multiple layers to it. It's very fascinating, and you
Mhm.
have to be able to approach all of that. So people who are looking for a physician who just takes time to get to know them and has unrushed appointments and just dedicates enough time and tries to get to the root cause of problems, that is overall the type of family medicine physician I try to be. And then extra things that I do and things that I'm really interested in are musculoskeletal medicine. So people who suffer from like neck pain, shoulder pain, knee pain. Like I do osteopathic manual therapy. I incorporate that hands-on modality of treatment to address many problems, like even recurrent sinus infections. I
Wow.
really try to prevent putting people on antibiotics unless it's needed because it can really wreak havoc in your gut health.
Right.
But once I put a patient on an antibiotic, I delve further into how did this happen? Why was your immunity low? What is going on? And I also use manual therapy techniques to help improve their drainage channels and their lymphatic circulation and address any restrictions that are going on. So when you come to me for a upper respiratory infection, I'm most likely going to be placing my hands on your neck, inside your mouth to address different nerve roots and any restrictions that are there to improve the natural flow of things. So that's where the natural holistic part of everything comes in. As a DO, I was trained to do this in medical school, and I really incorporate that. Then women's health, that's another strong area for me. I also trained further in pelvic health. And so I have a lot of women who have recurrent urinary tract infections, who have various kind of pelvic issues, bladder issues that I like to work with. I do a little bit of combining the manual therapy and the pelvic floor rehab together. And at
Okay.
times when I feel like they need further care, I will refer them out to a specialist who specializes in it, like a physical therapist or occupational therapist who can work with them more extensively with that. But that is how I incorporate my manual therapy aspect. I also do incorporate a lot of Ayurvedic medicine in my practice. And Ayurvedic medicine is a 5,000-year-old science
Wow.
that's originated in India. And it is, it's withstood the test of time. It's still practiced to this day. Me and my family incorporated. It's just been a part of our life.
Right.
And I I've had many health issues and GI issues, and I've been taking like proton pump inhibitors and antacids for many, many years. And then finally I went to India, and that is where I did Ayurvedic medicine and
Wow.
healed myself. And that was very, very powerful for me. And I wanted to bring that to my patients. So right
How
now
long
I'm
did it
in,
take you to heal yourself?
so it took me about 1 month, and it
Okay.
was really with like lifestyle, dietary changes, and some Ayurvedic treatments. And things can come back. If we ever have any imbalance, that is showing our area of weakness. It's like our Achilles tendon, right?
Right.
And so that means that there's a propensity whenever the balance is off in our life for that problem to come again. So, unless we keep on working on maintaining the balance, our problems can come back. And so, we have to really understand, why is my acid reflux coming back? I tell my patients, think of your body as a child. And when there are symptoms coming up, like you're having hip pain or you're having earache, congestion, don't just be angry towards your body saying, oh, you're failing me, you're being weak. Think of your body as a child where it's crying out for help to identify the root cause. It could be a
Mhm.
diaper change, it could be it needs a feed, it could be that it's in pain or just wants to be cuddled. So our body needs to be treated with care like that, right? Do you know what I mean?
Yeah, I love that analogy.
Yeah. And so that's where I teach patients compassion towards their own body. When people start manifesting symptoms, I try to help empower them to understand what could be going on. What is your body truly trying to manifest, truly trying to speak to you? A sinus infection could be a sign of horrible gut health and
Right.
therefore bad immune system. It could be a sign of really like bad sleep habits. There's so many things, eating habits. So, musculoskeletal medicine, getting back to the topics that I'm interested in, women's health, I do Pap smears. And Pap smears with me is a very different experience, by the way. I incorporate my yoga techniques. I'm a yoga teacher. So I incorporate my meditation, yoga, as well as my pelvic floor techniques to relax my patient as much as possible before doing a Pap smear. So I try to just take it at their own pace and make things as simple and convenient for them and easy for them as possible. Um, so with the Ayurvedic aspect of things, I'm currently in school for
Okay.
Ayurvedic medicine, and I'm just seeing how far I can go in it. And there are different levels of training right now. I'm at the Ayurvedic coach level, so I am offering Ayurvedic coaching to my patients and even members who have another primary care doctor but just want to come to me for Ayurvedic coaching. And then other things are just chronic disease management. I really like working with patients with high blood pressure, high cholesterol, diabetes. Um, I love working with people to reach their goal towards a healthier weight. Um, and yeah, I mean, I think that covers mostly everything that I offer.
No, that's awesome. I did have a moment to briefly look over your website, and I did see how there is like a membership type of um like one that's like an option. Is there also like you can come one time, like let's say for a woman I would need a one-time pap smear. Is that an option too, or do you have is it mostly based off the membership options?
That's a very good question. So, I am seeing patients who are part of our community, who are my members. So, when you join my practice, you are getting the whole deal of a primary care service. And even if somebody feels like, hey, everything is going well in my life overall, there are things that can come along the way. You may have an infection, you may cut yourself when you're cooking in the kitchen, you may burn yourself. You may be in a situation where you don't know how to deal with even a small problem, like maybe you're just really constipated. And rather than Dr. Google, it's best to have a primary care doctor who you can reach out to, even at times where things come up. So you may
Right.
not have a chronic problem. You may just want to have a physical once a year, but you know that you have a physician who you can reach out to for good, reliable information and help with anything. Because there's no limit to how much I am going to be there to help my members. You know what I mean? If you pay that one monthly membership, it's
Hmm.
unlimited appointments. I can talk to you over the phone as much as you need. I am there for as many video appointments. You can come see me in my clinic. I'm in my clinic only on Tuesdays for
Okay.
now because I'm just starting up. I don't have that many patients right now. And the other days, I see my patients virtually. I also do home visits for a few select patients, and that is more for people who are homebound or there's an emergency that came up, let's say on a Friday, and I'm not in clinic and you have a laceration. If I'm able to come over, I can suture it up for you. So if you sign up to be my member, there is no minimum period that you need to sign up for. So let's say, next month or the month after, you're
Mhm.
like, I can't afford it or it's not for me anymore. You can cancel, and there's no like fees or penalty for that. Um, but I feel like when patients experience the good care that they can receive when they sign up as a member, they will stay.
Right. I have a what about how does that work if someone doesn't have insurance? Does that still, as long as they're paying that monthly fee,
Yeah.
or is there additional cost if they don't have insurance?
No, this model of care is perfect for people who don't have insurance. Because from a primary care perspective, I can take care of pretty much all, chronic diseases and many acute things within the scope of my practice with just that one monthly membership. So, small business owners who
Mhm.
can't afford insurance, this is a great opportunity for them to have a primary care doctor. And then, let's say something comes up where they need to see a specialist. I'm going to work with them to find a specialist who may also see them for a fee based schedule.
Right.
So, that's why I really hope that small business owners hear about this because I'm there to help them. And it's only like $45 starting for adults, and for kids, it's $35. And it includes like unlimited visits.
I know that's amazing. I
Yeah,
feel like it's so important to get this out there because a lot of small businesses, or if they're just even just a single entrepreneur, they're paying hundreds for either health insurance or they're not getting
yeah,
health insurance because of the cost. So I
yeah.
think that I might just have to send this video to like all the businesses that I'm connected with and let them hear about this because I think it's an amazing opportunity that more people need to hear about.
That would be great. I really want to work with people to just find what works for them. And if you are looking at insurance, I don't know, it's really expensive, and there's a high deductible oftentimes for small business owners. And they get rushed appointments that are 15, 20 minutes long, and it's really hard to get hold of those doctors. But instead, if you become part of my practice, you'll be one of few hundred patients only. And right now, I don't even have that many patients because I'm officially opening on April 4th.
Oh, wow.
Yeah,
Congratulations.
yeah. And so right now, what I'm doing is I'm doing meet and greets for free virtually to meet with any patient who is interested in just learning more about the practice. And I help them understand, just to break out of that conventional thought, I need insurance. I have to have insurance. You need insurance to see specialists. So if you're like, you have multiple health conditions, you need infusion treatments, or you need specialty level care, or you need to be going to the hospital often, yes, insurance is helpful. But for people otherwise having just like high blood pressure, or I don't know, hair loss, skin issues, just female gynecologic issues, just having a good primary is enough. And think
Hmm.
about it, you're only spending 45 or $65 a month, and all of that is included.
Right. That's amazing. I'm kind of
Yeah.
excited about that.
Yeah, yeah. It is a very different model of care that is just rolling out. It's just been a couple of years, but doctors who are in this model are really happy, and the patients are really happy too.
Yeah,
And
absolutely.
like I said, I'm only going to have about like 200, 250 patients. So, and after that, I'll be closing off because they're going to become my family and I'm just going to be taking care of them. And so it's best to get on board earlier than later.
Absolutely. Yeah, absolutely. I'm definitely interested for myself. So being a
Of
little selfish
course.
here.
Spread the word, spread the
Yeah,
word. That is what
absolutely.
I
Yeah.
love. And if anybody wants to learn more, they can just go to my website, havenfamilyhealth.com. And there's a green button on the top right corner where you can schedule the meet and greet. That's for free. And you can chat with me in person and see if this is a good fit for you.
Awesome. And I just shared the website link on this Facebook Live too. So,
Awesome, awesome. Yeah.
yeah.
And so the other question I just want to touch on was many people who have insurance will be like, oh, she doesn't take insurance, therefore I can't be her patient. That's not true. Um, Almost all the patients who have signed up so far are people with insurance.
Oh, wow.
It is because they can't keep their insurance. I can still order labs, images, order referrals, order everything that you need. You can still use insurance towards that. You know what I mean?
Hmm.
So if I order labs for you, you can have your insurance cover the labs. You can have the insurance cover your medications. I just won't charge you for my office appointments through your insurance or for any of my services. And everything is upfront. And that is why I just want to practice honest medicine where I let you know upfront, this is how much it's going to cost before I do anything. And everything is really transparent and straightforward, you know?
Right.
And I hope that people take a look at my website. There are different types of memberships there, basic plans and premium membership. And we offer a lot of point of care testing and EKG, everything is included, pre op visits. Yeah.
Awesome. That's so cool. Is there anything that we haven't touched on that you still wanted to make sure anybody heard about?
I think we have covered everything. I just want people to not feel like, oh, the office clinic location is in Jacksonville Beach. I'm too far from that. Don't think like that. We can have virtual appointments. You know, you can drive over there just once every 3 months. If you need, I can come and visit you for home visits. So if you think outside the box, you know, great things can happen. And it's hard to find the right fit as a primary care doctor, and that is a huge decision because that doctor is going to be your family doctor for many years to come. So it's like having a family member and inviting the right person into your home.
Right.
So it's a hard decision, but an important decision. So at least meet with me. I hope to meet more people. And I'm looking forward to the expo.
Yes, yes. So to kind of wrap it up, then please visit Dr. James's website at www.havenfamilyhealth.com. And up in the corner, there's a green button if you would like to schedule a kind of meet and greet. That's free to get to know more about the services and what she has to offer. And then also, if you want to come meet in person, we're having our free holistic event February 19th. It's at the Renaissance Resort in the World Golf Village. It's free to the public. First 30 attendees will get free swag bags, and we'll have about 50 plus holistic um, um, vendors there. My mind went blank for a second, but we invite everybody to come out, and I think it's going to be a great time. And thank you so much for sharing all that information.
Thank you. Thank you so much for your time, Melissa.
Absolutely. We'll be in touch soon.
Yeah.